World Hepatitis Day, July 28th, is observed as the World Hepatitis Day. We have World Health Day, we have World Digestive Health Day, and we have so many health conscious days are observed in the year throughout. But July 28th is special because it is the birthday of the Blumber, the person who discovered hepatitis B virus. After the hepatitis B virus was discovered, we realized that the B virus not only causes liver disease, it also predisposes to liver cancer. So in that way, hepatitis B became very popular and important. It is one of the cancers that could be prevented by containing this very deadly viral infection. On this occasion, we not only get more aware of the life-threatening viral infections like B virus or C virus, we also get more information and awareness on the other group of hepatitis which are predominantly in the society or a community. What we mean by hepatitis is an inflammation of liver or swelling of the liver. So how do the people come to know that they have hepatitis? Unfortunately, the hepatitis presentation may be as simple as that they may not have any complaints at all, or they may have a serious problems like jaundice. We all know jaundice means yellowish discoloration of eyes and urine, and they may have decreased appetite and then vague body aches and something like that. So we may have a person having hepatitis with no symptoms at all to symptoms like jaundice and generalized weakness. Sometimes the presentation can also be first time as liver failure. So a person can present as first time in his life as distension of the abdomen or blood vomiting, swelling of feet and unconsciousness also. That may be the first presentation of the liver disease or hepatitis in this instance. So we need to know that the hepatitis can manifest as simple as no complaints to as serious as liver failure. There are various conditions that can cause hepatitis. The commonest cause of hepatitis being viral infections, hepatitis A virus, B virus, C virus, D and E virus. As of now, we have that many alphabets that are filled for the diseases. But of course, there are a lot of research and science has to come up to find out the other causes of jaundice which do not fit in these alphabets right now. The other common causes for hepatitis in the community we come across is the alcohol. Alcohol is another public health hazard where the patients after taking alcohol for a long time can present as hepatitis or liver disease. There are several drugs which are available in the market like the painkillers, antihypertensives, medications used for epilepsy, diabetes. So many of these drugs can also cause hepatitis. It is good to be aware that there is no drug that is free from causing any liver problem. So any drug is a potential to cause a liver injury, especially for those people who are elderly, who are already having a drug abuse, who are already having alcohol ingestion, and who are already on a polytherapy for various medical illnesses. They are at high risk for drug-induced hepatitis. The other causes for drug-related hepatitis we come across are the drugs used for the common tuberculosis. That is very prevalent in our community. The tuberculosis can present as a lung disease, extrapulmonary disease, a bone disease, even skin disease. So majority of the manifestations of tuberculosis, when the anti-tuberculosis drugs are used, they also are at a high risk to develop hepatitis. And these days there are so many what we say is indigenous formulations. They are used for the so-called wellness drugs. The people, even if they are healthy, they take it for improvement of their health. They may be in the form of indigenous herbal medicines and non-conventional drugs which are available just like the over-the-counter, some Ayurvedic formulations. Most of these drugs, they are really not safe from the liver point of view. So when you take it for some other purpose, these drugs can also cause serious health-related liver-related problems. So you should be very careful in jumping and then taking some medication in the anticipation that they may be good. But a fraction of those patients are also can develop the drug-related liver problems. So these are all the general conditions which can cause hepatitis in the community, but amongst all the things, what we are looking at today is the so-called preventable hepatitis in the community. The commonest cause is the B virus infection and C virus infection. Among the viruses from A, B, C, D and E, I would specifically mention about the B virus and C virus because the infection will not leave the patient without harming. So the patients can develop serious problems when they are affected with B virus or C virus. Whereas A virus infection, E virus infection, they are usually controlled by simple measures and preventive measures. Especially the A virus and D virus is very predominant in this season of beginning of summer and beginning of the rainy season, where there is a contamination of water and food sources. The people easily can develop these foodborne hepatitis infections. Whereas the B virus or C virus infection can be transmitted through routes like percutaneous route or sexual transmission or even a blood transfusion, if it is not properly screened, can contribute to the infection of these individuals. So when somebody is requiring blood, it is imperative for all the blood banks to screen their blood by a definitive and appropriate test to exclude these B virus and C virus in the donor's blood. And also safe medical practices like using disposable syringes, needles, using gloves in the hospital practice, proper sterilization of the operation instruments, and then serving the patients with hepatitis with proper barrier nursing, especially in the accident and emergency wing. When the patients do come, we have to follow something called universal precautions, that every person needs to be looked at as a potential candidate for hepatitis infections. For hepatitis B, luckily, there are very good drugs available, and it is probably one of the first hepatitis virus where we can see the cure for liver disease, especially when the diagnosis is made in a very early stage and the treatment is employed. These days we have very good drugs with an excellent safety profile. When they are given the proper duration and under supervision and followed by a specialist, we can ensure that the patients can be cured for their life. But at the same time, I must caution that ignorance on this disease, thinking that they may not require these drugs, they will go for some unbranded medications and Ayurvedic medications for which we don't have enough evidence. They are risking their their life in gambling and then trying to use the medications which are not properly tested in the scientific community. So I would say that once a diagnosis is properly made and you give the medication, hepatitis B is a preventable disease. Not only it is preventable, it also can prevent the cancer in an expected patient who is suffering from that. The other virus which is worth mentioning here is hepatitis C virus, which is even more deadlier than hepatitis B virus, because the hepatitis C virus, the recovery from the hepatitis C virus seems to be less frequent than hepatitis B virus. So you should be a little more cautious and be careful when dealing with hepatitis C virus. So the prevention of both hepatitis B virus and C virus include the same, safe handling of infected materials, using gloves and then syringes and needles properly disposing, and more awareness of the virus, how it is transmitted and how it is prevented. That goes a long way, especially in the medical community and paramedical community when they follow it. For the public, it is very much essential to know that where such practices are prevalent or employed, in fact they should choose such institutions where the awareness and then prevention is practiced wholeheartedly, and they are sure that they will not be getting that sort of an infection. Even for hepatitis C, right now there are very good medicines are available, but right now the medications are a little more expensive, but the good thing is that the new medications are readily available for cure of even hepatitis C today. And the other common questions what are usually used, there are some special populations like medical community, laboratory people, nursing people. You know, in the hospital there are several categories of people who are in the housekeeping. Everybody is at risk. So it is better that people at risk definitely have to take the active immunization as a prevention of hepatitis B. Unfortunately, we do not have vaccination for hepatitis C, but at least wherever the vaccine is available, it should be universally adopted. In fact, we used to identify high risk category of people in the community and recommend that they should definitely take the vaccine. But right now the recommendation is universal. Anybody and everybody are at risk of hepatitis B, and it should be taken, the vaccination should be taken as a universally. In fact, I am happy to know that the Indian Pediatric Association has incorporated hepatitis B virus vaccination into their immunization program of expanded immunization program, and the current generation of children are lucky in the sense that along with the polio DPT they are also getting the hepatitis B vaccine. So this has a long-term implications in the sense that next 10 years, 20 years down the lane, we may probably have a population free from hepatitis B. This should be one of the preventable hepatitis in the community. Just like we are looking for polio-free world today, maybe a day will come where the world will be free of hepatitis B. Other populations we must be very careful in dealing with the children and the pregnant women. See, children again are a special population in the sense that in children the acquisition of hepatitis B has a long-term implications. They are likely to become carriers, and it is one of the very significant population where we should avoid long-term carrier incidents in preventing the hepatitis B virus in children. Next important virus is the pregnancy, and usually the tendency of an antenatal checkup is they will do blood sugar and blood grouping along with the other hemoglobin and other things. They are routinely checking for hepatitis B virus. I am happy that the awareness is increased and they are more aware even in the obstetric and gynecology community also. So the pregnant women are screened for hepatitis B virus during their antenatal checkup, and they are also given vaccination if they are not exposed, and if they are detected to have the viral infection, they also are given treatment and advice. So my conclusion is that you should be aware of the hepatitis in general, especially hepatitis B and C, and also alcohol and so many drugs which are amongst us, to be very careful in using it, and then use the existing methods of awareness, and then use the medication in a right time, proper time, and prevent the disease and cure the disease. Thank you.